Okay, thank you, everyone. I hope you've all had a great break. The first thing I wanted to highlight is we are aware that there is a very, very, very long line for the accessible bathrooms. So if you don't need to use an accessible bathroom, there are other bathrooms also downstairs, and there's lots of them. But if we could just reserve the accessible bathroom for those who need it, that'll be much appreciated. And we have fixed the catering issues, so we will make sure that there is a lot more food at lunchtime. So we apologize for that. Our next session addresses the elephant in the room, the responses to the Disability Royal Commission. So to lead this session, I'd like to invite Deb Fewster, Director of Policy and Advocacy at VCOSS, to the stage to kick off this session. So welcome, Deb.
Thanks, everyone. There's such a great energy in the room, and we run a lot of events, colleagues at Daru and at VCOSS, but this really is genuinely like my favourite event of the year. So thanks for all the great energy that you bring in. And I know that this is a workforce, a sector that really, I think Julie mentioned some comments this morning around the stress and the strain. So I really want to acknowledge that, express my solidarity as an ally, and thank you for the strength and courage and kind of relentless fight that you bring to all these spaces. So thank you. Before we kick off, I do want to thank Uncle Perry Wandon this morning for a really beautiful and generous welcome to country. I would like to pay my respects as others have this morning, and acknowledge that we're meeting on the lands of the Wurundjeri people, and pay my respects to elders past and present, and any First Nations people here today. So in this session, we are going to spend some time unpacking the Victorian response to the Disability Royal Commission. And we've got a lot of experts who are going to be on this stage today, in this session, but I really do want to make a few comments about how we've structured the session. And you'll notice I use the royal we. I do really want to say, when I say we, it's Melissa. I think we all know the extraordinary leadership that Melissa brings through her coordination or management of Daru, and she's got a great team at Daru behind her. So the way that Melissa has really intentionally structured this session is that we're going to hear from the Victorian Government, and then that's going to be followed by a bit of a Q&A session. We've got a short amount of time for that, because really what we want to do is hold space for you, the people in this room. We're going to have some leaders from the disability advocacy sector on the stage to talk about their perspectives and insights. And I think that structure speaks to many of the themes that have come up already this morning about the sector leaning into its power and into its leadership. We have government coming into a space that's been created, curated, held, led by Daru, supported by Disability Advocacy Victoria, and supported by VCOSS in allyship. And I was talking with Julie Phillips and Christina Ryan just a little while ago in the break about, I hope that we're holding ourselves as VCOSS to a really high standard in terms of ethical allyship. It's not just allyship, but there's a lot of kind of dimensions to that in terms of the ethics of that and the credibility of that. So we've asked government to come into this space that is owned by the community and speak to their response to the Disability Royal Commission to this community, and then holding space for the sector to talk about what you think is next. And I guess before I, introduce our colleagues from government to talk to the government's response so far, I do want to, just make a few quick remarks about some of the comments that Christina Ryan made this morning as well. I was telling Christina I've literally written pages of notes from her keynote address this morning, and amongst the many kind of lessons and insights that Christina shared from her extraordinary leadership, to the things that I picked up amongst many are, expect better. And to focus on the issues as well. And I think it's in that spirit that I do kind of want to open up this space and kind of invite Lucinda Garrido, who's the Director of Disability and NDIS Reform from the Victorian Department of Families, Fairness and Housing, who's going to take us through the government response to date. As I mentioned, then we'll have a short, we'll have a Q&A, quick one, and then importantly, we'll hold a lot of space for a panel discussion where we'll hear from three leaders from the sector, but it's an opportunity for you to have your voice from the floor as well. please be mindful with these things. As always, we've got we have a room that is not full of wallflowers. We have really strong leaders in this room, so I know that there will be lots and lots of hands up. We'll try our best to get through as many of kind of your questions, your comments as possible, but sometimes we just can't always get to everyone, but we'll try really hard. You can use a QR code on your table to have your say, and as Melissa mentioned earlier, we have our colleagues Adam and Noah here today who are recording a video piece at lunchtime. So that's another way for you to have your voice. We want to hear from as many of you as possible in as many ways as possible. So it's my pleasure to invite Lucinda Garrido to come and speak with us in the first instance. Thank you.
Pardon me. Thanks so much, Deb, and to Melissa as well for inviting me to be here today. I'd like to start by also acknowledging the traditional owners of the custodians of the Wurundjeri and Bunurong lands of the Kulin Nation on which we're meeting today, and pay my respects to elders past and present and Aboriginal people who are in the room with us today. So thank you to you all for inviting me into your space, and I look forward to discussing today about the ever-changing landscape of disability reform. I'm going to provide an overview of the Victorian Government's work on disability reform, including the implementation of responses to the Disability Royal Commission and the forthcoming NDIS review. And as was mentioned, I'll take some questions at the end also. Before I delve into this, I want to acknowledge that advocacy plays a vital role in upholding disability rights, addressing discrimination and harm, and driving inclusion. Advocacy will play a central role across all of the disability reforms that I'm speaking about today. Ongoing engagement with the disability advocacy sector and all of your organisations is going to be critical to the successful design and implementation of the reforms. So as you very well know, it's an understatement to say that it's a busy time for disability reform, both in Victoria and across Australia. The release of the final reports of the Disability Royal Commission and the NDIS review present an important opportunity for us to work together to deliver long-lasting and transformational change for people with disability. Victoria takes its role as leading the nation on supporting the rights of people with disability. We've done that over a long period of time, and it's something that we're very committed to taking forward in this current disability reform context as well. The Victorian Government has made significant investments to improve the accessibility and inclusion of our education, transport and health services, as well as our public spaces and social housing. We've implemented various legislative reforms to strengthen the rights, protections and safeguards for people with disability in Victoria, as well as nation-leading programs such as our former individual support packages. However, in the current environment, I do want to acknowledge that we're hearing that there's significant apprehension and anxiety in the community and sector due to the forthcoming changes. We are hearing you when you say there's a lack of information currently available about the reform agenda, particularly around foundational supports and recent NDIS legislative reforms. We're in a tricky position at the moment. Negotiations between the Commonwealth and states and territories on key issues related to foundational supports are still ongoing, with many key overarching decisions yet to be made. And I do want to acknowledge that it's a very challenging environment for the community and the sector to be continually operating in. And I do recognise that with that void of information, there's a lot of discussion as to what will be the future of the disability reform agenda. But we're seeking to close that gap as soon as possible. And it's very much on our radar, and we're really keen to work with you as we move into the next phases. So there is a lot of work going on behind the scenes so that the Victorian Government can prepare for the design and implementation phases. And while we're not yet able to commence the discussions until we know who we're going to be designing for, we are preparing to be able to engage when we can. So we're not just sitting and waiting, rather we are listening and hearing what many of you are coming to us and saying, and we are making sure that Victoria is well placed to move forward with the Commonwealth and other states and territories once the key overarching decisions are made. And we want to make sure that the disability reforms are joined up and that there's a holistic approach to the reform agenda, as we have heard the community say that there is that desire for. So the release of the Disability Royal Commission's final report provides a pathway for continuing the pivotal reforms that I mentioned earlier, with it setting out a vision for an inclusive Australia and calling for significant action to ensure the human rights of people with disability are upheld. Some of Victoria's own reforms and initiatives were highlighted by the Disability Royal Commission as leading examples of disability inclusion. These included the Residential Tenancies Act that has specific protections for residential rights in specialist disability accommodation, the incorporation of a contemporary framework for supported decision-making under the Guardianship and Administration Act, and the application of co-design principles to reshape Victoria's mental health and wellbeing system. And co-design is also one of the 6 systemic reforms outlined in Inclusive Victoria, our state disability plan. On the 31st of July, the Victorian Government released its response to the Disability Royal Commission alongside the joint response by the Commonwealth and states and territories. And Victoria's response builds on the commitments of inclusion and accessibility in our state disability plan. Of the 130 recommendations that fall within the responsibility of Victoria, either solely or jointly with the Commonwealth or other states and territories, 107 were accepted in full, in principle or in part. 22 recommendations require further consideration and 1 recommendation was not accepted. Of the 45 recommendations that are the sole responsibility of states and territories, Victoria has accepted in full, principle or part 37 recommendations. I'd like to take this opportunity to thank and acknowledge the Victorians with disability and disability advocates, many of whom are here today, who advocated for the establishment of the Disability Royal Commission and who generously shared your experiences and expertise throughout the 4.5-year inquiry. I'd also like to recognise the additional supports provided by advocacy organisations that enabled people with disability to provide submissions and testimony to the Disability Royal Commission. And I acknowledge that there has been some disappointment with the initial response. I'm keen to emphasise, though, that the release of the Victorian Government's response is just the beginning of our work in responding to the Royal Commission, and the Victorian Government will be considering the implementation pathways of these recommendations now and over the coming years. Your voices and voices of all people with disability will remain at the forefront of our reform efforts moving forward as we work together to plan and implement the recommendations. As we move into the phase of considering how to implement the recommendations, we look forward to working with VCOSS on a series of engagements over the coming months to inform our detailed implementation planning for both the Disability Royal Commission and broader reforms. We are working with the Commonwealth on a series of engagements on foundational supports proposed to be held in late October. The engagements will include a focus on general foundational supports, and we're committed to sharing information with you as soon as the details are available. The Victorian Government will build on this work with further engagements on general and targeted foundational supports later this year and into 2025, when we will be able to engage in much greater detail following the release of the foundational support strategy. And that will go to a lot of those high-level decisions that are still outstanding. These engagements will include a focus on underserviced groups and communities to ensure all people with disability have an opportunity to inform the design and implementation of foundational supports and the broader reforms. Your advice and expertise is critical to our implementation planning efforts. Victoria is also committed to transparent and robust reporting on the recommendations and will be providing biannual reporting to the Commonwealth, we'll be providing biannual public reporting and implementation of the recommendations to the Disability Reform Ministerial Council also. While we consider how to implement the response of the Disability Royal Commission, we're also considering how to integrate the response with the NDIS review, which is forthcoming, so that there's a joined-up reform agenda. In June, disability ministers across the country agreed to develop a joint response by the end of this year. We're currently working with the Commonwealth and other states and territories to develop a joint response. A significant element of the NDIS review has, of course, already been agreed to, and that was the decision in December 2023 at National Cabinet to implement foundational supports, which would be designed, funded and commissioned by the Commonwealth and states and territories. The NDIS review recommended that foundational supports be established so that some people with disability are able to access the supports they need outside of the NDIS. This is a significant change and one that seeks to build an interconnected disability ecosystem, given the NDIS review findings that there were gaps in the delivery of a broad range of supports for people with disability. We expect that the foundational support strategy will have a lot more information about how we can plan for, coordinate and implement foundational supports across the country. And as I mentioned, we're advocating that as soon as key details are settled, the information will be shared with the disability community so there's a clear and shared understanding of the role of foundational supports across the disability ecosystem. And implementation of the responses of the Disability Royal Commission and the NDIS review will build on the work already well underway in Victoria, included in our commitments in our State Disability Plan. In 2024-25, the Victorian Government invested a further $24 million to support Victorians with disability, and that included support to a strengthened Victorian disability advocacy program. Students and their families also have access to NDIS navigators as part of the $203 million Fighting for Students with Disability and Their Families package, and the $24 million also covered a range of other initiatives. So advocacy is set to play a significant role in the delivery of general foundational supports. As I previously mentioned, the Victorian Government is planning to work with VCOSS on a series of engagements. So we're keen to engage you and the sector, the advocacy sector as a whole, on what foundational supports should look like and how it should work. We're committed to working in partnership with people with disability and the advocacy sector to plan and implement the forthcoming reforms. We know that working closely with the disability community is essential to delivering high quality outcomes and the transformational change. We look forward to working with you to undertake this process in the near future. I'll pause there and invite the Q&A session.
Thanks. It's Deb Fewster here again, and I'm going to sidestep from the microphone in a moment, but I'll just open up this Q&A session. Thanks so much, Lucinda, for your presentation. Looking forward to questions from the floor. I thought I might just as well quickly remark briefly on what role VCOSS might play as well. So again, really want to kind of acknowledge the importance of community-led and sector kind of led responses. So very kind of mindful of VCOSS's role as a cross-sectoral kind of mainstream peak body for community services. So I guess the way we really see our role is, I mentioned before, kind of ethical allyship. And so it's around like just ensuring and kind of creating and facilitating pathways to like linking up with the disability advocacy sector. Very, very mindful of the role of our peak body, Disability Advocacy Victoria, and obviously in a national context, there's DANA as well. So I do want to just like make those clarifying comments. I think where we really see a very kind of key role for VCOSS is alongside DAV, providing really strong support to DARU, and also I think, putting a spotlight on our mainstream community services. The NDIS review talks about an ecosystem of supports, and so we really want to make sure that mainstream kind of like subsectors, whether it's child and family services, family violence, homelessness, the community legal sector, that all of those sectors are aware of kind of their responsibilities, their obligations to provide inclusive and equitable access to all Victorians with disabilities, whether they're NDIS participants or not. This is about everyone's right to equal service, particularly like our universal services as well. So I do just want to make that that comment as well. Sorry for taking up time, but I thought it was an important clarification, and keen to open up to the floor. So Julie, you've got the microphone, and I'm going to step aside so that Lucinda can answer questions. Thanks.
Yeah, thank you. Julie Phillips here. Thanks, Lucinda. Lucinda, you were talking a lot about co-design and then you were speaking about liaising with VCOSS as well. My observation is, and I think it's shared by a few other people, is that the government and DFFH does not have a relationship with disability representative organisations. And liaising with VCOSS in relation to the DRC recommendations with respect is not appropriate, and I think this is what Deb was alluding to. It would also not be appropriate for Disability Advocacy Victoria to be liaised with as the primary liaison. When is DFFH, or does it realise that having an advisory committee of disability individuals and liaising with organisations that are not disability-led organisations is not meeting the requirements in the disability plan of co-design with people with disabilities? And would you be open to revisiting your consultation process to ensure that the main people who are consulted about the disability recommendations, which most of us don't accept, directly with disability community representative, organisations? Thank you. And I realise that these are not your personal decisions, so please, you're very brave to come out here. Please don't take anything personally.
No, thank you so much for raising that. And it's a good point, because we do need to make sure that we are hearing from all different parts of the community and all different types of organisations. And when I referenced working with VCOSS, it's on the stakeholder engagement plan itself, so that we can actually make sure that we're then going out and talking to all the right organisations and people. And so we're in that process at the moment of designing that, and it's something that I definitely take on board, and we'll take back and have a critical look at what we are planning, because it is still being planned, and make sure that we are addressing that, because I think that's a very valid point, and we are keen to ensure that we're talking to lots of different types of organisations and people. And we're very conscious as well that the Commonwealth primarily deals with disability DROs, and that we want Victorian organisations to be part of that conversation as well. And so we're working with them to ensure that they have a broader list of organisations that they'll be consulting as well. So we're really trying to step beyond what perhaps we have done in the past, and ensure that a range of voices will be at the table.
I'm not sure if my lapel mic is working. Is it working? Great, thank you. We've got another question somewhere else. I can see my colleague Emma's got a microphone. Is there anyone else with their hand up? Oh, there's at the back, Julianne. Yep, thank you.
Thank you, Martin Stewart, Blind Citizens Australia. You know, the disability movement, the collective, the advocacy bodies are completely amazed that we have had to have a suggestion for foundational support. And I'll tell you why. Because it should have been designed in from the beginning. Why is it that we're in the position that for those who fall short of qualifying for NDIS support have had other supports withdrawn? Why? Simple to us. So we've had to be possibly too restrained, no longer. Now we know that you're working on it. Who would have thought that for a system that began the rollout 2013, NDIS, that its own workplace would be inaccessible for people who are blind or vision impaired, and perhaps some others? How have we got to this place? I'll tell you why. In my opinion, it's because of what we spoke about before, the lack of people with disabilities recruited into leadership, decision-making, legislative roles. That's why. And that's why it's so important that we heed each other's call, come together collectively as organisations, as individuals, and really ensure that this time, at last, we get it right. Thank you.
Thank you. I'll go to the first part of your question and comment regarding the implementation of supports outside of the NDIS over the last 10 years. As many of you would know, there was the information linkages and capacity building element that was originally designed into the NDIS, and for a range of reasons was not implemented as originally designed. And I think that it's quite well recognised that that was one of the issues and by the NDIS review, that having not been implemented in the way that was originally intended, that it did open up a gap. I think with the NDIS review, having a view to the disability ecosystem and looking at it as an ecosystem with various parts of the ecosystem needing to work together and building on additional foundational supports, that there will be a more holistic a range of services on which people can draw from. And I would say that Victoria is feeling we are well progressed in terms of establishing foundational supports. I think we're one of only a few jurisdictions that did keep a range of programs going when we transitioned into the NDIS, where other jurisdictions did close down a lot of their programs, and that money was funneled into the NDIS, and that was by design. So I think we're now looking at how we can establish additional foundational supports to build out that ecosystem so that people can access services outside of the NDIS, and that commitment was made at National Cabinet last year. And so, as I said, we've got quite a lot of high-level decisions to be made as to the scope and breadth of foundational supports, and we're working through that at the moment. And then we'll move into that phase of what does it actually look like in Victoria, and design what the service system will mean here, and have and see what is happening across other jurisdictions as well, because we do want to make sure that there's that consistency across jurisdictions, and that's the work that we'll be doing over the next while.
Thank you. I think I can see another hand up at the back. There's a microphone coming to you. Thank you.
Hi, I just wanted to, I'm Tanya. I asked a question before. I've always got questions, but I just want to try and maybe if you can clarify, or maybe you can kind of surmise for me how this is going to work, because as we all know, the NDIS has a very big pull as far as financial gain for a lot of therapists and a lot of service providers and a lot of support workers. If somebody's not eligible for the NDIS, but they need to use state-funded services, mainstream services, that sort of thing, I guess where I'm going with that is it's got to be as attractable as the financial gain that people are also making in the NDIS, because we already know that when people are using mainstream services and so forth, it could cost $80 to get an OT assessment or to go to an OT. But as soon as they know you've got an NDIS plan, it goes right up to $193. So there's got to be something there that needs to be looked at to make it just as financially attractive to the state's services as what it is with the national services. Does that make sense? Or
It
the national
does.
program?
Yeah, thank you. And it's something that is definitely something that we're thinking about and considering how will we address that in the design of foundational supports. Unfortunately, I don't have an answer to that today, but I think that that's something that we're going to have to grapple with over this next period. And we're really keen for voices like yours to be involved in the engagements to raise those concerns and challenge us in the design thinking so that we do ensure that the issues that have eventuated in the current design don't get translated into the new disability ecosystem as well.
Thank you. I can see it's Heather, isn't it, from YDAS? Has got their hand up. Emma's going to bring a microphone over to you, Heather. Thank you.
Yeah, I'm Heather from YDAS, the Youth Disability Advocacy Service. In this conversation of the Disability Royal Commission recommendations and their implementation, we hear the words supports and services used a lot. But what I'm not really hearing is human rights, and that they're the initial recommendations that we heard from the Disability Royal Commission, and we're not hearing that from our governments in their responses. But if disabled people's fundamental human rights are upheld everywhere, then a lot of these mainstream and foundational things we're talking about and their costs and all that kind of thing actually go away because disabled people don't need them anymore because their rights are being upheld and all of our systems are being made accessible. The other thing that I find really curious as well is that we've got this, with the state government, we've got this teeny tiny little Office for Disability that is funding teeny tiny little amounts to advocacy organisations who are then in turn advocating on behalf of individuals back to very large state government and federal government, but state government organisations such as child protection, the family violence system, the courts, the education system and so on. I'm really interested to hear of those bigger systems, child protection, family violence, all of those other ones, what's their role going to be in implementing the Disability Royal Commission recommendations?
Yeah, sure. Thanks. So I'll take that in two parts. First of all, I would say that the human rights of people with disability is absolutely paramount in our thinking. I think in terms of the Royal Commission response, it was looking for legislative change, and that is something that does take time to consider and look at the federal context as well as the Victorian context. It's something that we are giving further consideration to, and that is because of the complexity of the system that we are trying to change. Changing legislation always takes time, and I think going to the second part of your question, there's so many portfolios that are part of this change, and so we are definitely engaging with all of the different parts, but it's a very big ship to steer and change direction, and so that does take time, but we are absolutely looking at what the Disability Royal Commission has said about that, and seeking to work with the Commonwealth on those changes and then look at the Victorian changes that will subsequently take place as well. So that is absolutely something that we are giving much consideration to. And in that same vein, we're working very closely across the Department of Families, Fairness and Housing that has all of the portfolios, or some of the portfolios you mentioned, as well as across Victorian Government with the Department of Justice, Department of Education, because we see that these reforms are everybody's business. This isn't just about the disability area in DFFH driving these changes. And so we have across government leadership driving these changes, and we're going to be engaging through each of the departments, so leveraging some of the advocacy committees that they have, or advisory committees, that they have established to receive advice and engage with people with disability through the various portfolio lenses as well, so that these reforms are taken across government. And so we'll be continuing to do that as we do our implementation planning and look at the different initiatives that we can progress in order to acquit the recommendations over time.
Great. There's one last question just at the front here from a fellow Deb. Over to you. Thank you.
Hi, my name's Deb and I'm coming from ARDAS, which is in the northeast of Victoria. I'm listening to what's been said by yourself, Lucinda, thank you, and many of the previous speakers. What I'm interested in knowing is who's going to have the oversight over your government to make sure that this happens in a timely way, and is there a threat that if for some reason your government isn't returned next year, that will still continue, whatever decisions are made? So who's going to have the oversight to make sure that what you're saying actually happens? And B, if your government isn't returned, is that still going to be the case?
Thanks for the question. In terms of oversight, the governance body that oversees disability reform is initially the Disability Reform Ministerial Council, and that's made up of disability ministers from across Australia. And then we also do report to National Cabinet as well. So there is really high level oversight, and if the government were to change, there would be a change of representation into those ministerial bodies. And so that would continue, that we would be engaging. And we have the Royal Commission response, but it's also supported through a number of other policy positions and responses, such as the state disability plans, such as the National Disability Advocacy Framework, and other initiatives that scaffold around the response as well. And so I can't speak to a future government and their intentions. However, there has been public commitment to it, not only from a Victorian perspective, but also at a federal perspective. And we are working towards a lot of these initiatives. And as I mentioned, Victoria, very proudly so, is pushing forward in many different directions. And so we will continue to work towards that. Sorry, there was another aspect to your question, or you look like you've got a follow-up, so.
I think you've covered it. Thanks.
Okay, thank you.
Thank you. It's Deb speaking again. So that want to make sure that we're also respecting the time of Philip, Sandy and Jeff, who are going to join us on the stage now as well for a panel conversation. So we'll draw that to a close. Thanks to all those that asked questions. Sorry if we didn't get to some. As I thank Lucinda, I think was it Julie or Christina earlier today used the analogy of a lion's den, that people in this room sometimes go into the lion's den. In this case, Lucinda's entered into our lion's den today. So I do want to thank Lucinda for coming, fronting up to the room and speaking to government's response. And, you know, Lucinda actually wouldn't say this herself, but I'll say it. Lucinda only found out 48 hours ago that she was going to be the person speaking today. So I do really want to thank Lucinda for coming and engaging. And I think, you know, what I heard Lucinda say is that, you know, and I know this can be, you know, frustrating for the people in this room, but, you know, it is, we're being told it's the beginning of a process, and we're being assured that there will be co-design, and it's up to all of us to really kind of keep pressing hard on that. But in the spirit in which you've come into the room, Lucinda, I really want to thank you a lot, and look forward to, you know, everyone in this room and people who are not in the room today having, you know, access to tables and to conversations. So thanks so much for coming today. Thanks, Lucinda.
I appreciate it. Thank you.
And now we're going to move to the panel session. So it's my pleasure to welcome Sandy Ross to the stage, Philip Waters to the stage, and Jeff Smith to the stage as well. So, okay, thanks again. It's Deb again. So now we've got the panel session, and I'm going to introduce you to our panellists. I know that they'll be well known to many of you in the room, but really want to pay respect to my colleagues here and, you know, introduce them properly. I have been told I talk pretty fast, and I've been asked to slow down as I do these introductions. So I'm going to try and speak a bit more slowly so that my colleagues are able to interpret at a good pace. So first of all, I'm going to introduce Sandy Ross. Sandy is the CEO of Rights, Information and Advocacy Centre, also known to many of you as REAC. And Sandy also wears another hat. You wear many hats, Sandy, but one of your other hats, an important hat in this room, is that you're the Treasurer of Disability Advocacy Victoria as well. Prior to working at REAC, and this is when I first met Sandy actually, Sandy spent 5 years as the Executive Officer of Financial Counselling Victoria, also serving on the Executive Committee of the Consumers Federation Australia. And Sandy's career has included stints at the Telecommunications Industry Ombudsman. Sandy's been an academic at the University of Melbourne School of Social and Political Sciences. And Sandy's also been Secretary of the CSIRO Staff Association and of the CPSU Science Division. So very, very eminent colleague on this panel. We've got another eminent person on the panel, Philip Waters. And Philip Waters is a proud deaf man, General Manager for Deaf Victoria, the peak organisation representing deaf and hard of hearing Victorians. Previously, Philip was a Senior Human Rights Consultant at the Victorian Equal Opportunity and Human Rights Commission. And while Philip was there, he worked with organisations to develop diversity and inclusion action plans and gender inclusion strategies. And Philip's interested in engaging and developing partnerships with change makers in both consumer organisations and policymakers. And he is passionate about deaf and hard of hearing people in the Pacific. And I think I'd remark on that note about developing partnerships with change makers in consumer organisations and policymakers. Certainly, I'm very grateful in my role at VCOSS as the kind of mainstream cross-sectoral peak body to have Philip very kind of engaged in the work of VCOSS and really kind of informing everything from election platforms and state budget submissions through to advocacy around inclusive education and more. So thank you for that partnering approach that you bring, Philip. And then my third very eminent colleague on this panel is Jeff Smith, and Jeff had a little chuckle there, but you know, Jeff, you are a powerhouse. Jeff is the Chief Executive Officer of Disability Advocacy Network Australia, also known as DANA. And as many of you will know, DANA is the peak membership body for independent advocates in Australia. Prior to joining DANA, Jeff worked as a senior executive for 15 years, being a long-standing CEO of Environmental Defenders Office New South Wales, as well as People with Disability Australia. And Jeff is a person with a disability who has moved into the disability sector in recent years, while also continuing to work in the environment sector and seeking to identify linkages between the sector. And again, as a Victorian organisation, you know, we're very kind of respectful of and appreciate the role of DANA, Jeff. And I think, you know, there's been a lot of challenges at the federal level with peak bodies and representative bodies over many years not being appropriately resourced to do the work. And I'm really have lots of admiration for how DANA has just really kind of pushed hard for resourcing for peak bodies as well. So thank you. So I'm going to start with a question to all of the panel. It is, you know, how are people with disabilities and their representative bodies reacting to government's proposed measures? Who'd like to go first? Sandy, happy for us to start with you as we move along the panel this way?
Yeah, okay. I just want to acknowledge, Deb, that I'm here in a capacity sort of as an ally, and you know, that limits, I think, my capacity to speak on certain things, and I want to acknowledge that just to start with. I think we clearly are facing a big challenge in the disability advocacy sector around what's occurring and where the politics is sitting for disability. These challenges are big and significant. And Christina's amazing address this morning highlighted the importance of just the resilience and the strengths of people with disability and the allies and all of us that are working in this space are going to need to call on all of that to respond to these challenges. How do we influence and shape something that's a lot better from government at state and federal levels is really the key question, I think, for us. And it's not easy, I think, to answer that question of how. There's going to have to be a lot of work, and there's going to have a lot of building of the kinds of collaborative and collective arrangements that Christina was talking about. And I think, though, that the Royal Commission recommendations do provide us with some useful things to argue for. It's been a very poor response so far from government to it, as we all can see. So what's our next step to get them to do better, I guess, is the question for me.
Thanks, Sandy. Philip, really interested to hear your reflections around, from a deaf and hard of hearing community perspective. How has your community responded to or reacted to government's response so far?
Thank you for that, Deb. The DRC itself, we're really excited to get the report. There were a lot of recommendations to do with disability that we, once in a generation opportunity for all of us. We're very excited to see what the outcome would be. And I think we're rather disappointed. Maybe I'm not brave enough to say more than just a little disappointed in the recommendations in the report. The focus on deaf and hard of hearing people wasn't there. There were a lot of recommendations for other disability groups, and I was pleased to see that. But for our constituents, our stakeholders, they collated a lot of stories. We had a lot of witnesses, people that gave evidence. And, they were pretty consistent with the messaging, and yet that's not reflected in the report. So when the government responded to the DRC, we again were a tad disappointed that, they really could have looked at what wasn't in the report, what could have been added to it, what were the potentials. And I think they looked at the challenges. And there are a number of things that they pointed out. We're already doing these things. We've already met some of these recommendations. And I think we were left thinking, really? So, for example, when it comes to deaf education, our constituents say they want education with other deaf and hard of hearing people. We clearly stated that in our submissions. The community itself was mobilised to put in that recommendation. That's not reflected in the recommendations, though. At the same time, we were pleased with the Victorian government's response that said that at 7.15 there would be a focus on specialist schools and mainstream schools working in collaboration. So we were pleased with the Victorian government's response in that regard, but that was the only one recommendation. They didn't actually accept it. They looked at 7.14, which was getting rid of specialist schools. But the Victorian government, we were really pleased that they did consider 7.15. That was in our favour. But in general, there was no recommendations or focus on those that were deaf or hard of hearing.
Thanks for sharing that, Philip, and just really want to kind of acknowledge, for the organisation that you lead and for the community that you're part of as well, like the work that has kind of gone into build that kind of confidence and safety for people to be able to feel that they can share their story, that support to tell their story, the kind of the scaffolding around them, the debrief that happens after people, render themselves even more vulnerable in terms of sharing stories, thinking about some of the shame, the stigma, the trauma that sits around that storytelling, and just want to say, in solidarity, I, just want to, acknowledge that the disappointment and the trauma that must come from then not seeing justice be done to those stories and to that storytelling. So thank you for sharing those insights with us. Jeff, this question around how representative bodies are reacting to government's proposed measures, thinking about the kind of national ecosystem that Dana is part of, what can you share with us around the kind of reaction or response so far to government's proposed measures?
Yeah, I think it was fairly universally, or if I can talk from the point of view of Dana to start with, I think the response was, underwhelming is one word, and I think that's a polite word in many respects, but it was also quite demoralising for people with disability. I think it was underwhelming because we got, at the federal level, there were 13 recommendations which are accepted out of 130 solely for the federal government. And that is in the context of people spending a decade getting the Royal Commission up, 4.5 years of a Royal Commission, 12 months of the government considering those recommendations, and there's all this work ahead. So there's 117 recommendations which will fall back on all of us to push government to turn those recommendations into change, the transformative change that was promised us. The demoralising point, I think, Dana, is a disability-led organisation. 80% of our senior leadership team, people with disability, 60-odd% of our staff are people with disability. If you take into carers into account, it's up to just over 80%. There was quite a visceral reaction to the kind of ambivalence, if you like, of the response that we saw. Why I mentioned the last bit is that some of the institutional changes that we were seeking around being disability-led have not come through in the recommendations. So this was a process where it was about giving people with disability control of our lives. There was a lot of the recommendations and the narrative around the Disability Royal Commission and the NDIS review as well about people with disability being at the centre of it. We haven't seen that, and yet we still continue, particularly and I'll stop for the moment because I'm sure that future questions can talk about it. We haven't seen that. We've seen government going away as part of a task force and then coming back to us with certain things. Thanks.
Thanks for sharing that, Jeff. And I know I'm quoting Christina a lot, but, Christina's the leader of the Disability Leadership Institute. And I think, we want to run with a lot of the kind of, challenges, provocations and encouragement that Christina has provided us with today. And again, Christina said, people can say no. People have a right to expect better. And so just, I guess, thinking about, Christina's encouragement and challenge to us, if these initial responses are really disappointing, people are feeling let down, how can we ensure that the momentum for change continues, even despite that kind of disappointment and perhaps, not having that necessary conditions being kind of created in government's response? What can we do to, I guess, create that momentum for positive change? It was a question that I was going to ask to Sandy, but it might be something that all of you might like to remark on. Is there anyone who'd like to go first in asking, in answering that question around how we create momentum for change?
I'm happy to begin. I think that the thing that flows out of my initial response is there is still enormous, that initial visceral disappointment. There is still enormous room for agency on the part of the sector. So we've got at a federal level, and a similar situation, I understand, in Victoria, we've got 117 recommendations which are accepted in principle. We have the imprimatur of the Royal Commission itself, which I think we can hold on to. We've got Australia's disability strategy that gives us a framework for implementation. So we, as a sector, can seek to hold the government to account around the things that they have accepted in principle and to turn those into the change that we want to happen. No one's resiling. Governments are not resiling from the need for transformative change. We just haven't got the kind of traction on those at the level that we want. But there is enormous potential for us to use that, exercise our agency, and there's lots of mechanisms that we can do to hold the government to account, but I'll leave it there for the moment.
you. Philip or Sandy, did you want to add to that at all? Do you have any reflections you'd like to share?
I'll just wait for the interpreters to swap, and I've just realised I'm watching the wrong interpreter. The interpreter that's interpreting for me is sitting in front of me. So, just in general, when we think about state and Commonwealth governments and the staff that are working within them, very knowledgeable when it comes to policy writing, very knowledgeable about setting up systems, but they themselves don't have a lived experience of a person with a disability in general. They need to also have courage to ask the disability community to be more approachable, to be able to get feedback from us, because we are people with a lived experience, rather than going on and doing their own thing in their towers in isolation and coming up with policies and processes that they end up having to retrofit. They don't fit us. We need to develop a good working relationship. We need the space to do that. We need the resources, the time to be able to come together and be included and be inclusive. So it was interesting, the discussion today, working with VCOSS and ensuring that there's partnership with other disability organisations, because often here the Victorian government, when you compare what's happening abroad, I think the Australian government and the state government is forgetting who the representative organisations are and who are the service providers. That's lost. Okay, disability service providers, they put us all in the same basket, and we're not. We're quite distinct. So it's important that we have a voice. We have disability organisations that represent people with a disability, and we have service providers. It's important, yes, to consult with both. Both parties have something to say, but I think it's really important that they consult with people with a lived experience. So the Office of Disability, the NDIS reform, we need to have, and VCOSS, we need to have a good discussion between us. So just to give you one example, when it comes to the state government and the state government doing better, one of the recommendations in the DRC of 7.2 with regard to the Auslan workforce, and we want to grow the pool of Auslan interpreters. Now that sounds good, but there's a lot more to it. It's multi-layered. So DEFVIC and ASLETA is the peak body that represents Auslan interpreters, came together and sent off a letter to the Minister for Industry and Housing. We actually offered our time to give them advice. The Victorian government response was that they were going to develop a strategy to increase the pool of Auslan interpreters. And they're meant to come up with that approach by September. Okay, so we sent off a letter 2 months ago. We received an acknowledgement letter of our email, and a week later, we received another letter, which was a thank you. That was it. That was the extent of the communications. We offered, we put ourselves out there. Where is the interest? Once again, we have to then approach them, knock on the door, and ask to be included. You know, it's more than just training interpreters. We need to have deaf organisations and interpreters coming together. I mean, yes, we could do better. We need more representation. So government departments are responsible for specific recommendations, and they need to find people with that lived experience, that knowledge, and they need to bring them on board early. Don't wait until you're about to announce the plans and the processes that you want to put in place.
Thank you so much, Phil. And I think that what I'm kind of picking up from your remarks and like your reflections on strategies that you've tried, and then how you need to kind of like then recalibrate the strategies is that, and it again goes to kind of some of the things that Christina was talking about earlier this morning, which is that, you know, something that you might, you know, politely construct as an offer actually is about reframing and saying, actually, it's not just an offer, it's actually an expectation. Like, this is the way that we expect you to, you know, lever in our expertise. And also that comes with a price as well. You actually have to invest in resourcing that capacity and in order to leverage that capability. So I think some really interesting insights there.
Deb, I think I'll make a call tomorrow morning, I think. Take you up on that.
Sandy, do you have any kind of reflections on this before we turn to the next question? And also, please start to put your hand up if you've got questions of our panel as well, and we'll throw to the audience for questions if people have them.
I haven't got a lot to add, Deb. Pretty amazing responses from Jeff and from Philip. And I just come back to Christina's address. She said so many things that were just so fundamental to, I think, acknowledging the strengths that people with disability bring to all of this, the lived experience, the passion, the resilience, all those things are just so crucial to building what has to be in the end a collective response. But it's complicated, it's hard, it's going to take courage because of all the diversity in the sector. It's so easy for that to be lost. I mean, I think the things that Philip was talking about just reflect how things get so lost and so easily dismissed or not heard. So that it is a massive challenge, but the answer, I think, is things like this conference today. I mean, I thought it was fantastic to watch the interactions with the people here with Lucinda's address. I mean, that to me was just gold. I mean, this is the stuff that we need to be doing. It's a long road, but I think, yeah, there's so much capacity here as well to build on.
Thank you. Are there any, I can see a hand going up just towards the back there. Julianne's coming with a microphone. Thank you. If you could just introduce yourself as you ask your question as well.
Martin Stewart, Blind Citizens Australia. Just imagine this, February 15 approximately, we as a collective put out a media release, all of us, our CEOs, signatories. Sorry, Deb, I didn't ask you before saying that. That's my CEO. Imagine we put out at the beginning of the election campaign how we feel, what we think, what we know. And we speak to not only people with disabilities, but to those who are related, who have family members. We speak about our productivity that would increase to become taxpayers, more likely to be, if things are heard and therefore improve. So, in my view, this is an opportunity that we should be building now to create, to release around that time. Not much point doing it now because it'll dissolve into a bit of sugar in a cup of coffee. Then you know what happens to sugar in a cup of coffee, it eventually dissolves. We don't want that. We want it to gain traction and to be in the voters' minds when they go to do just that. So that's my solution-based, and it is, when I say solution-based, it won't necessarily be the solution, but it may create the solution. Let's be honest here, we have not got a major political friend currently. The people who made the system, for example, the NDIS, have let us down. You know who you are. The people who may be an alternative to the current government, well, they need to hear us. I think that's the only way we're going to gain traction, to make this an election issue. Point towards it. Have people think about their family members if they're not a person with a disability. Have people with disabilities agree with us, because I'm sure we will be projecting their voice. Thank you.
Thanks so much, Martin. And I think that's a really good, opportunity for the panel to perhaps reflect on, what are some of the kind of strategies that we can be using to effectively mobilise public and political support to push for more meaningful change. So Martin's talked about media advocacy as a tactic, linking that to the election cycle. The views or ideas that you've got around how to mobilise support and build power, recognising that we're not starting from a blank sheet. This is a community that has significant power and able to kind of really lean into that and realise its full potential. Any ideas from the panel?
I'm happy to start if you like. Yes, I agree with all those sentiments. I think we do have enormous power. I think we forget sometimes how much power we have, particularly if we are united around that. So Dana did some work around the Priorities Project, and that was a Priorities Project that was around looking at the big, I was interested that Philip used the word, the term rather before, that we're in a generational moment. It's exactly the same term that I've been using as well. This is a really, despite the underwhelming response, et cetera, it is a really exciting time. There is the power for change that still exists at the moment. The Priorities Project work that we did two things. It straddled those big reform processes, but it was disability-led, and that profoundly influenced the outcomes. We spoke to 130 people, we spoke to our members, we spoke to individual advocates, spoke to people with disability, we spoke to the disability representative organisations and so on. And the issues that came out of us straddled both the federal and the state. So it's things like foundational supports, it was advocacy itself, it was representation and inclusion, about having people with disability at the centre, it was around eligibility and access for disability supports, which again is NDIS and outside the NDIS. So all those issues can unite us in the way that we move forward. There's also becoming a bit of a model out there. I spoke before about, continually trying to knock on the door around nothing about us without us. I was at a session where we're hearing from the task force about the Disability Royal Commission the other day, and someone put their hand up and said, why is this taking so long? And he said, we've got to remember that there's 9 entities around the table, and they've got to agree, and then we've got to go out to the community. We want to have 10 entities around the table, the 10th being us, right? That's what we need to change. That is the current abiding, if you like, DSS and task force model, despite where we're trying to get to. But with the agency, some of the changes they've had in the NDIA recently, where they've got a board which is disability-led, and some of the changes at the top, we're now trying, I call it shared decision-making light, because it is a little bit light, but Dana plays a role in that space of co-chairing the regular 3 monthly forums with the agency, and that co-chairing means devising the agenda, putting the issues from DRCOs on the agenda, going back to them, prosecuting the case, and so on and so forth. So there is a model out there that we can use, and we can go to government and say, no, it's not about you working out what you want to do and then coming to us. We want to be at that table at the outset, and I think we should focus on that and keep pressing for that in and of itself.
Thank you, Jeff. And I don't have a watch on my clock, but I think I'm running a bit short on time. Yes, I am, and people have got to get to lunch. So I might just see if Philip and Sandy have any other kind of closing comments around mobilising strategies briefly, and then we'll draw this session to a close. Thank you.
I'll keep it brief, Deb. I would say get out and visit and meet with your local MPs, state and federal. Be in their face about these issues, constantly be agitating on this stuff. And I think the direct interactions with local MPs strikes me as maybe something more we can be doing more in. It helps to shift the whole atmosphere around the sense of what's required. And that's what we need. We need to shift that, I think. So that strikes me as just one fairly simple kind of thing that we can, and it's good to, when you're doing that, to share with everyone else about what you're doing. So we all have a sense of what's going on and what's being said, and we can do that in a collaborative way.
Great. Thank you, Sandy. Final word from you, Philip?
Just a very quick word. I think the focusing is on solutioning the answers. When people can talk about problems all day, okay? There's plenty of problems. We'll never finish that discussion, but that monologue. So we need to think about media and other organisations and governments and getting their focus on the answer, the solutioning. That's where our focus needs to be able to assist them in developing that solutioning. And government is public service to make sure that they're also brave and courageous in listening to us and getting us on board. You know, not paying expensive consultants or doing it in-house, but speaking to us.
Thank you. Thanks for that. And that draws this session to a close. Sorry, it's run a little bit over, but I'm sure you'll all agree it was really valuable. So thank you and look forward to a lovely lunch. Thanks.
Well, thank you very much to Sandy, Jeff, Philip, and Deb for this fantastic conversation. We've all gained a lot from it, and I think the conversation still needs to continue. So please continue the conversation over lunch. I encourage you to continue connecting and discussing what you've heard. Remember to use the QR codes, and also in the corner, just where the little couch is next to the window, the video station will be set up. So please go over there and do your little interviews. And tell us what you think. Tell us how you're feeling about the Disability Royal Commission or anything else that you've heard today. And I encourage you to bring your lunch back at 1:15 because we've got a really, really special performance for you all. See you soon. Enjoy.